Namaste, and a very warm welcome to all of you, my friends. I'm so thrilled you're joining me today for this explainer. Look, today we're doing a deep dive into something that affects literally almost every single family, decoding those confusing cholesterol lab reports. We're going to cut through the noise and separate the absolute truth from the common myths circulating out there. But hey, before we jump in, could you do me a quick favor? Just take 1 second to hit that like button and subscribe to the channel. It really helps us keep bringing these vital, life-saving health breakdowns directly to you. All right, you ready? Let's get started.
So tell me, is your cholesterol truly normal? You see, we often get our blood test back, we look at the paper, and if the number is inside that printed bracket, we think, fantastic, I'm perfectly fine. But here's the reality check. A normal lab report on paper doesn't always mean it's optimal for you. A lot of laboratories are actually still using outdated reference ranges. Current medical guidelines recommend much lower targets than they did even just a decade ago, especially if you're dealing with conditions like diabetes or have a history of heart disease. So normal on a piece of paper, not necessarily normal for your actual heart health.
Here is our quick roadmap for today. We'll cover the good and the bad, fats and what to actually eat, the silent health danger, we'll bust some statin myths, and finish up with brain and body facts. And remember, if you enjoy this kind of structured learning, definitely hit subscribe.
All right, Section 1, the good and the bad. Let's identify the actual heroes and villains floating around in your bloodstream. Before we can bust any myths, we really need to understand what we're dealing with. Cholesterol is simply a waxy substance found in your blood. It's not inherently evil, guys. The impact it has on your health depends entirely on the type of cholesterol we're talking about. Not all of it behaves the same way in our bodies. And honestly, this is where so much of the confusion starts.
So we have two main players. On one side, there's LDL. You can easily remember this as the lousy or bad cholesterol. This is the villain that builds up in your arteries and causes silent damage over time. We absolutely want to lower our LDL. On the flip side, we have HDL. Think of the H as healthy, or the good cholesterol. This is the hero that sweeps through your blood vessels, cleaning up and protecting us. We want to keep this good HDL as high as possible.
Let's look at the math. Because a really dangerous myth is thinking, well, my total cholesterol and my LDL are fine, so I don't need to worry. No, my friends. Having high triglycerides and low good cholesterol is incredibly risky too. Your non-HDL cholesterol needs serious attention if it crosses 130 milligrams per deciliter. And for that healthy HDL, men need to keep it above 40 and women need to keep it above 50. You've got to look at the whole picture. Moving to Section 2, fats and what to eat. Let's talk about how the food sitting on your daily plate directly affects these reports. The crucial takeaway here is this. You absolutely do not have to cut out all fats. That is a very old, very busted myth. What you actually must do is cut out the bad fats, specifically saturated fats and trans fats. You know, the stuff found in deep-fried foods and highly processed snacks. Instead, bring on the good fats. Excellent examples of these include olive oil, a handful of nuts like almonds or walnuts, and fatty fish. These good fats actually support your body in managing cholesterol properly. Now, here is a fact that surprises almost everyone I talk to. People generally think, I should only cut fats to fix my cholesterol, right? But if you want to lower your triglycerides, which again is a very dangerous type of fat in your blood, cutting out excess sugar and alcohol is the real secret. Your body converts that excess sugar directly into triglycerides. So if you really want to improve those lab numbers, you've got to put down the sweets. Let's step into Section 3, the silent health danger. We have to tackle one of the most dangerous misconceptions about how we physically feel day to day. You might look at your report and think, okay, my numbers are a little high, but I feel perfectly fine. I have high energy, no chest pain, literally no symptoms, so why should I worry? Please listen to this very carefully. Cholesterol damage is completely silent for years. It slowly and quietly builds up plaque in your arteries without giving you a single warning sign. That is, until a heart attack or stroke suddenly happens. Keep this stark number permanently etched in your mind. 200. A total cholesterol of 200 is considered borderline, and anything above 240, that is dangerously high. You cannot feel these numbers inside you. Because of that, you must get your blood checked regularly, even if you feel like a completely healthy champion. All right, Section 4, statin myths busted. We are going to rapidly dismantle some of the heavy anxieties people have about statin medications. This right here is perhaps the most profound takeaway of this entire explainer.
There's a massive myth where people say, hey, my cholesterol became normal on the tablets, so I just stopped taking them. My friends, statins control cholesterol. They do not cure your body's underlying tendency to overproduce it. Stopping your treatment the second your numbers look beautifully normal just lets the bad cholesterol rise right back up. Reaping the benefits requires lifelong management.
Another huge fear is that statins are going to severely damage your muscles. People are genuinely terrified of this. But here is the fact. While mild muscle aches can sometimes happen, they are usually very manageable. And if you're truly worried about it, your doctor can do a very simple CK blood test to quickly and accurately rule out any real muscle damage. To give you some peace of mind on just how safe these medications generally are, true, severe muscle damage from statins is incredibly rare. We're talking about it affecting only about 1 in 1,000 people. That means 999 people out of 1,000 don't experience this severe issue at all. The life-saving benefits for your heart are absolutely worth having an educated conversation with your doctor rather than just acting out of fear. Now, I hear this one all the time. People say, I take my fish oil capsules and I eat raw garlic every morning, so I definitely don't need any chemical statins. Please, don't fall into the trap of thinking supplements are a total replacement for medical treatment. Yes, high-dose fish oil is wonderful for lowering those triglycerides we talked about, but scientifically, garlic lacks solid proof for major cholesterol reduction. And more importantly, neither of these will effectively lower that highly dangerous LDL, the lousy cholesterol. For that, statins are very much needed. What happens if you start taking statins and your blood sugar goes up slightly? The myth says you should stop the statins immediately. But the medical fact is this. Statins can indeed cause a very mild bump in your blood sugar. However, the heart protection benefit, meaning preventing a fatal heart attack, is so massive that it far outweighs this minor sugar bump. The correct move is to work with your doctor to gently adjust your diabetes medications, but absolutely keep taking the statin. Finally, Section 5, Brain and Body Facts. Let's look at how cholesterol impacts your genetics, your brain, and your overall body. So many folks just throw their hands up in the air and say, my father had it, my mother had it, it's genetic, diet and exercise won't do a thing for me. That is a completely defeatist myth. Yes, genetics absolutely matter, for sure. But the fact is, lifestyle changes still help immensely, even with a strong family history. Having the genetics simply means you have to monitor it closely, treat it much earlier, and strictly maintain those diet and exercise habits. You definitely don't just give up. Now, this is a very fascinating biological fact. People worry that because the brain needs cholesterol to function, taking statins will cause memory problems. But high blood cholesterol actually raises your risk of vascular issues, which is much worse for your brain. The reality is your brain is incredibly smart. It doesn't actually need high levels of cholesterol in your blood because it manufactures its own local cholesterol directly from fats. It totally protects itself. Consider this truly surprising fact to put your mind at ease. Think about newborn babies. They are going through their absolute peak period of rapid brain development, right? Yet, a newborn's total blood cholesterol is only around 100 milligrams per deciliter. They clearly do not need high blood cholesterol for their brains to grow rapidly, and neither do you for yours to function properly. Finally, let's clear up a very persistent bedroom myth. Because cholesterol is indeed a necessary building block for sex hormones, like testosterone and estrogen, some people believe lowering it with statins will kill their sexual desire. Well, science tells us a very different story. Taking statins does not actually reduce your libido. In fact, keeping your blood vessels clear and healthy is vastly better for your overall vitality. So, my friends, we've reached the end of our journey today. I want to quickly remind you to always consult your own doctor for personal medical advice, because every body is beautifully unique. But I want to leave you with this final, provocative thought. Now that you know the myths and the facts, will you let the silent damage continue in the dark, or will you take proactive, educated control of your health numbers today? Thank you so much for learning with me, and I'll see you in the next explainer.